Now, officials in KwaZulu Natal are keeping a close eye on residents as COVID-19 cases increase across the country. The province records at least 10 new cases daily, with the epicenter in eThekwini being a major concern. President Cyril Ramaphosa is visiting KZN this morning. Let's get an update on whether people are adhering to the regulations, and we speak to KwaZulu Natal Premier Sihle Zikalala, who joins us via Skype from eThekwini. Premier, good morning to you, and thank you very much for your time. Firstly, I want to start off with the sad news that we've lost one of the country's football greats, Sugar Ray Xulu.
Yes, thanks a lot. Let us extend our condolences to the Xulu family, the AmaZulu team, but also to all people who love soccer in South Africa, for the departure of Sugar Ray Xulu, who have made a great contribution in the development of soccer in particular, but sports in general. We are with them, and we will be visiting the family soon.
Premier, let's then talk about the presence of the president in that province today. I think, if memory serves me well, this is his first trip outside the province of Gauteng since the lockdown. Why is the president there?
The president have undertaken to embark on a program to check the state of readiness of provinces in preparation or in anticipation of any worsening conditions in as far as COVID-19 is concerned. So he is here to be with us, to check how are we dealing with issues attending to the current challenge of the pandemic in terms of the program of screening and testing, but also to see how ready are we if things were to be worse in terms of preparedness for quarantining more people and isolating more people. So he will be here, and he will start by a meeting with the Provincial Command Council. Thereafter, he will go to the Pilsi Kaseme Hospital, which is yet to be opened. And it has not been used at all, but it's a place we've identified as one of those that will be used to quarantine and isolate those who are infected by the virus. And later in the day, he will also undertake the same visit to Pietermaritzburg.
Talking about the hospital that you've just mentioned, Premier, the Pixlika Isagaseme Memorial Hospital, that hospital, 28 billion rand was spent building that state-of-the-art healthcare facility. It was due to complete and open its doors back in 2014. Why has there been so much delay?
Well, firstly, I think the delay were around the question of permits in terms of your EIAs and everything. And thereafter it started, and the process of building has been going on. And we're happy that it is now ready to be commissioned. And we have ensured that as government we expedite the process of construction and finalization. Hence, we are saying now we are ready to open it, and it is one of those facilities that will be used for purposes of quarantining and isolating patients of coronavirus.
Yeah, Premier, you have come under attack more recently about what some are saying is your unfair focus on private healthcare facilities, like, for example, the Netcare hospitals that have been the center of attention in your province, versus the public hospitals, such as Eddington, where you had a nurse dying there. I think it was over the weekend, if I'm correct. How do you respond to those accusations, Premier, that you are more harsher on the private healthcare institutions versus what is seen to be a mess also on public hospitals?
I will beg that analysis should take the situation as a whole into cognizance. We are talking about one nurse in Eddington Hospital. You are talking about more than 12 cases of death that have came from one private hospital, St. Augustine. And that's why people will be unfair if they will then say we are harsher on the private hospitals, because that's where this has erupted, and that is where we've noticed that they've not acted properly in handling this matter. And I must say that private hospitals have contributed to almost 80% of the deaths that we have in the province of KwaZulu-Natal. But from where we stand as government, it will not help us to point fingers on each other. What will be necessary is to say, what is the solution? And once there is a problem, we must identify it and try to attend to it with speed.
Talking about the healthcare institutions, therefore, Premier, the Netcare hospitals, St. Augustine's and the Kingsway Hospital, which belong under this umbrella Netcare, you said last week that the investigative report that was underway would be concluded sometime soon. How soon can we see at least an interim report, and will you publicize it about what exactly led to so many infections that resulted in the number of deaths that we saw?
Indeed, we will definitely publicize it, but we will follow processes. And processes I'm referring to is that once the report is finalized, given to us, we will then take it to brief the management of the hospital, then make it public. We are going to do so. The investigation is conducted by the Department of Health nationally, and we will ensure that the minister expedite the process so that the matter is taken into conclusion.
And I take it that these two hospitals remain closed. And while you ponder that response, Premier, as I wrap with you also, please talk to me about the Ilembe district, and I'm talking about areas within this district such as Balito and Watuguza. This is where it is said to be possibly another epicenter of this virus, whereas we have been looking at eThekwini as the epicenter. It does appear that you might have a problem there as well.
Yes, it is emerging as the second center, which needs also serious focus. And as government, we've deployed our teams to work there and ensure that those who are infected are attended to with speed, but also begin to ensure that we trace the contact of those people so that this does not escalate and spread throughout the district of Ilembe. We are concerned about the high numbers that are coming from that area, hence we are attending to it with speed.
All right, Premier, and of course that particular response around the closure or perhaps the reopening of St. Augustine's and the Kingsway Hospital, do you know when that might be?
Well, we are going to push that the report be availed as soon as possible so that we will then conclude the matter and open the hospitals.
Premier, we thank you very much for your time. That's the KZN Premier of KwaZulu-Natal, Sihle Zikalala, talking to us there.